Hi, and welcome to Module 5. Today we're looking at feedback. What is feedback? Feedback is a cycle of collecting information from appropriate sources, processing the facts, and then providing it to individuals or groups about their behaviour. Feedback aims to assist individuals or groups to decide if certain aspects of their behaviour should be changed or can be maintained in order to achieve their goals. Appropriate feedback contributes significantly in developing learners' competence and confidence at all stages of their professional career. For nurses, it promotes reflective and experimental learning, especially when in the clinical setting or during on-the-job experiences. Professional feedback helps to identify and bridge the gap between actual and desired performance. If feedback isn't provided, the learner can assume performance is fine and continue practicing in that way, when the opposite can be true. So, who gives feedback? Everyone. From university educators, clinical educators, your supervisors, to peers, colleagues, and especially our patients. Everyone can offer feedback and a point of view on performance. There are numerous methods of delivering feedback. It can be informal, which is the most frequent form. It is provided on a day-to-day basis and usually in verbal form. Then there's formal feedback, which comes as part of a structured assessment, most frequently received from our superiors, and is usually in a written form. Formative feedback is termed for learning, and it's all about the learner's progress at a particular time, often about halfway through the course. Basically, it's when you receive pointers along the way or to see how you are going, if the behaviour needs to be modified before completion of the task. And finally, there's summative, which is regarding it's of the learning. So it's a measure of the overall performance at the completion of the task or course. Often it's measured against a standard and is coupled with a mark or grade. Feedback can either be all positive or it can be constructive, negative in nature. Positive feedback is where an individual or team is performing their desired behaviour and is encouraged to continue, while constructive feedback is where an individual or team is encouraged to engage in self-awareness and promoting change. So when you're giving feedback, there is an art to providing effective constructive feedback. In healthcare, there are a few commonly used models to help when providing feedback. The first one we're going to look at is the feedback sandwich, which a lot of you may already be familiar with. This is when feedback starts and concludes with a positive, with what can be considered more critical being sandwiched between those two positive aspects of performance. It needs to be noted that this method can actually lose its effectiveness if you use it too frequently. So an example of this is, say I say to a nurse or a nursing student, I noticed you made the patient and relatives feel very comfortable while you explained the procedure of receiving CT with contrast, and your explanation was very clear. It would have helped if you had given them some patient information pamphlets, as this time they seem to be very overwhelmed. However, you have set a time for meeting with them again, and this will give you the opportunity for answering any questions and giving these information leaflets. So you can see there, positive about making the family feel comfortable and the patient comfortable, and having a clear explanation, and then the constructive negative statement around perhaps patient leaflet should have been given, and then you finish off with another positive around the fact that the nurse or students created this next opportunity for education. The next feedback, when you're giving feedback model, is the chronological fashion feedback. So this model focuses on reflecting observations chronologically, so reiterating events that occurred during the session back to the learner. Note that this is most suitable for short feedback sessions. If the task is long and has many steps, it can slow down the feedback and reduce recipients' attention. So basically, if the task takes too long, recipient's going to stop listening because you're going to lose their concentration. An example of giving chronological feedback is the first thing you did was really well done. When you entered the room, you introduced yourself to the patient. Then you proceeded to reposition the patient without conversation, consent, or acknowledgement. It was after you moved their legs that you got consent and explained why you were moving them. This seems to have relaxed the patient. So first, second, and third action. And the last one is the Pendleton model. So this is more learner-centered. It's conversation-based and it identifies an action plan or goal. So it's more around the reflection in action, which you guys looked at in Module 1. So the facilitator checks in with the learner to see if they're even ready and wanting feedback. Then the learner provides background about what is being assessed and states what was done well from their point of view. This is a way of creating an environment of sharing and aims to prevent defensiveness. The facilitator then reinforces the positives and suggests what could be improved. A mutually agreed action plan is formed. Open-ended questions from the facilitator will provide an opportunity for the learner to reflect and think about the event, task, or performance. So an example of some of these questions is, what do you think went well? What do you think could be done differently? So the facilitator's asking the learner these sorts of questions to sort of get that reflection going. Overall tips for providing feedback. A big one is plan in advance. Sometimes you might need to modify the environment, so you need to find somewhere quiet, private, to create that sort of safe space. You want to give feedback promptly, so the timing of it is very important, preferably right after the event if you deem it appropriate. So it depends on your event that you're debriefing. Think about what you want to achieve and drive that discussion accordingly. So have a clear plan as to what you want to feedback and where you want this to go. One-on-one feedback is preferred. Start gently. This will prevent an automatic shutdown from the recipient. Be specific and action-focused. So caution when you're using, say, you, when addressing the learner. Better to focus on the behavior or the task performance rather than you, the person. Encourage self-reflection. So that's where your open-ended questions come into it and they can really help. Be aware of non-verbal cues. So your body language can make or break a feedback ultimately. So think about your facial expressions, your eye contact, having an open posture. And don't forget to self-reflect yourself. Once the feedback session is complete, how did you as a facilitator go? Some big barriers for feedback. So if feedback is too generalized, it's not related to specific facts. Those copy and paste statements that some of you as students may have received back on your essays, that's a really good example where it's just lots of those sort of generic statements. If there's a lack of advice on how to improve, if you're not giving advice, then it can very dangerously slip into criticism. If there's a lack of respect for the source of feedback. So if you don't actually respect the person who's providing you with this feedback and their point of view, then often that will impact how feedback is received. If there's a fear of upsetting colleagues, fear of damaging this professional relationship, if there's a defensiveness behavior or resistance when receiving feedback, there are physical barriers. We kind of already talked about how there's noise or improper time, place, or space is an issue as well. If there's personal agendas that come into it and that power play comes into your feedback, and obviously if there's a lack of confidence as well. So knowing what some of these barriers are to effective feedback, now let's look at how you're going to actually receive it. So receiving feedback, first of all, you need to be a good listener. You need to embrace the feedback session as a learning activity, not as a criticism of you as a person. Remember to pause and think before responding, so be reflective. Avoid jumping to conclusions, review what meaning you have applied to what is being said and what might actually be driving those conclusions. This could also mean that you seek further clarification before judging the feedback. Think positively and be open to helpful tips. Professional feedback will be more useful if you accept comments positively, so points for consideration, rather than dismissively, so for personal protection. Learn from your mistakes and be motivated to change. We were all learners once. Don't be afraid to ask for advice. Be a good sport and show appreciation. People providing feedback have gone to a lot of effort to provide it to you to the best of their ability. Be grateful and be proactive when feedback is out there and being offered. These are some of the references I used to put this presentation together. Thank you.